Yeah, my question is this, that everybody is working to strengthen the feminism, and it is good that we are working for that. But in a country like India, where millions of women are suffering, just they are not getting the primary health care even. So when we will start to save the women first, when we will start to save the adolescent first, when we will start a drive where we will be against the female infanticide, we are talking about gender equality. It is good. Even we also had a question, very big event in India in 2017, where 25,000 people, male dominating society, or we can say the male population, were gathered together to uphold the idea of gender equality. But since then I am working here, and the big question arises when I have diagnosed more than 3 lakh females in India through our initiatives, and we found that they are suffering from multiple diseases, multiple transferable diseases, HIV, STDs. They are anemic, and we are working on the gender equality. It is good, but when we will save the women, then we can have the idea of the gender equality. This is my first question. Also, we are working on a child marriages also. So this is, I just want to ask, then when we will take it as a primarily agenda to save the women in making their healthcare as a priority. Thank you so much.
Thank you, Devendra. Over to SG.
Now, I'm not sure if I understood well, Mr. Devendra, but I mean, it is exactly because in many countries we have dramatic basic problems in healthcare, in the economy, in income, in education, and we have whole areas of the population that have no access to basic services. This is not a reason to put gender equality as a secondary issue, because if those situations exist, the biggest victims of those situations are essentially women. And so, obviously, it's not enough to fight for gender equality. We need to fight for adequate health care, including sexual and reproductive health care. We need to fight for education for all. We need to fight to support by, for instance, basic income being provided. I remember Brazil, at a certain moment, they instituted the Bolsa Familia, which was a basic form of support to poor families, that all poor families would benefit, to guarantee that they would have a minimum. And several other countries have adopted measures of this sort. Others have more difficulty to do so. So we need to, of course, address the most dramatic economic and social problems, and we need to denounce the injustices of this world, the unfair globalization that we have unfortunately lived in for decades, that are responsible for those terrible situations affecting large sectors of the population in so many countries of the world. Even in developed countries, we have poor areas. I mean, we have racism and other forms of discrimination that make poverty be unevenly distributed. And I mean, if I'm in the US, the Afro-American community, for instance, has a much more dramatic impact, the problems of poverty, problems of health, etc., than other sectors of the population. So, I mean, it is clear that we need to address those basic problems, but it is clear that when those basic problems exist, the biggest victims are women. And so gender equality must be embedded in the way, and gender equality policies must be embedded in the way we address the most basic gaps of development and the well-being that any country has in relation to their populations. And of course, one of the big campaigns, you mentioned healthcare, that we are engaged in is for universal healthcare. And universal health care is, I would say, one of the most important objectives of the United Nations. And in universal health care, obviously, all the questions related to sexual and reproductive rights, but all the questions also related to mental health that is dramatically impacted by the COVID, and all the questions related to, the most vulnerable areas of the population, people with different forms of handicap, indigenous populations, etc. I mean, it's essential that policies to develop healthcare in a country are done in an equal basis and address the difficulties of all sectors of the population. The question of child marriage is a very important question, not only in itself. I mean, it's a dramatic thing that so many young girls are forced into marriage because of the extreme poverty of their families or because of insecurity problems and the way their families see as a solution when it is not a solution. It is another problem that makes it even more serious and more dramatic. Not only the problems of gender equality, but the violations of human rights. What the increase in child marriage is revealing today is the dramatic impact of the COVID-19 in the situation of women in general and of girls. We see girls much more impacted than boys in relation to school closures, and a meaningful number of girls are out of school. I believe we have 743 million girls out of schools and 111 million in LDCs. On the other hand, as many of the developing countries have a large informal economy, and the informal economy was dramatically impacted by COVID, and most of the countries have no mechanisms to support the informal economy. We saw more and more families going into poverty, more and more women going into poverty, and because of that, child marriage becoming, for many of them, and this is a big mistake, but in any case, in their, backward vision, a solution that they try to find. And on the other hand, the fact that the levels of poverty and hunger are increasing in the world makes women particularly vulnerable and young girls particularly vulnerable. And we see this dramatic increase in child marriage. This is central to all our programs, all our advocacy programs. And of course, the most important aspects that we have to address is the root causes of it. There are root causes that are political, that are cultural, but there are now specific root causes linked to the economy and to the COVID-19 impact. And what we have been pushing, first of all, is through a global commitment in order to support debt relief and to support the provision of much higher levels of liquidity